I hope it's okay with you. I want the other bit. Okay. So we want to discuss briefly on the topic of the use of technology in reducing or managing the burden of AMR in Liberia. Now, as you all know, antimicrobial resistance is really a global health issue.
This is not a normal speech where we just clap our hands. Take those, at the end of them, we allow you to ask few questions. Please.
Thank you for that, Chairman. This is not really high school graduation or university graduation. That we just let them go. But if I'm not here, if I leave, because I have two programs. But you can just some points, get your input, ask some questions for clarity. Are you hearing me about that? Okay. So this is interactive, and we will not stay long that we discuss. So as you all know, antimicrobial resistance is really a problem issue. I'm not going to recount everything about antimicrobial resistance because our well-learned colleagues have already said to you what antimicrobial resistance is. So you see that it is a persistent problem challenge. It is not just critical, it is persistent, it is going on, and it's like in our stomach to be still. Somebody said COVID has something still. So antimicrobial resistance, it is a serious problem challenge for the health. It is a challenge to the body healthcare system. It is a challenge to even the healthcare system such that treatment is difficult to achieve. In achieving it, we will be on our table, and we will have resistance to AMR resistance. And that will be a problem for treatment. So this is a global public health problem. Now, data have also been here, and this proportion burden of AMR in low-income countries. Now, Liberia is part of the AMR's So, like I said, maybe we end up doing a Liberia with get a message to get a person city. Now, studies have shown that there is a high burden of AMR in low-income countries, including Liberia, where it persists, and there is an important need for both in-depth analysis. Now, the thing about antimicrobial resistance in Liberia is that there is scarcity, there is paucity of literature, there is paucity of data. The other day we were having a program at the, at the SAT, and in passing someone asked a question. He said that there are 3,000 antimicrobial related deaths in Liberia. And then we also said that we will have a stigma. It will be more. And I said, instead of sitting and having party, it was a joke. Instead of sitting and having party, what we can do, we will train these young people, send them on the field, teach them how to do data collection, give them the data collection tablets. Of what is happening, instead of just sitting every day. Now, these people have the passion, they have the strength, they have the, you can see the zeal, the zest to move out there. And I just said, train them how to collect data, train them how to go out there, use technology, treat them in real time as they are collecting the data that is included in their quarters. Then we know the actual burden of antimicrobial resistance. 3,400, 4,000 related deaths. That's just an understatement. Because what the speaker just spoke here, they are not reporting what is happening in the hospital. They are not reporting what is happening in the community. They are not reporting what is happening in the clinic. Because many times, antimicrobial resistance mimics, it behaves. It just comes in the form of chronic disease condition. Our joke I always say, you remember Be Serious? Some people be serious those days. But then we said that it is Ecclesiastes. So we just said it is Ecclesiastes. But then I told somebody, I said, due to our porous borders, counterfeit substandard, forced labor of medicines are just coming in every day. So it is possible that this will be a drug reaction that people are not, and interestingly, nobody took that comment serious. But they who are there, and drug reaction. And many people die from drug reactions in Liberia. Those things are not reported. Now, I'm the chairman of pharmacovigilance and Liberia medicine and Liberia regulatory authority. So we are training young people, we are training people in the various facilities. Getting them to report is another war. Just getting them to report. Because they said they must be incentivized. And this is Liberia. You want incentive from him, but it will be your mother, your father, or your relative somewhere. But the actual burden of antimicrobial resistance in Liberia is known. So now we see that but that says an urgent need for more in-depth analysis. An in-depth analysis that has to do with interrelated coordination, transdisciplinary, multidisciplinary. You just bring all disciplines on board. Our Consummate is a bioinformatics student here. They're not hearing right. A student of bioinformatics. Very important part to drug development. Another person could be about technology. Billion needs all we can get, especially among the young people. Now we want to talk about the Liberia context, mitigating AMR using technology. Now, technology itself is high in other countries, but in Liberia, due to scarcity of funds, due to scarcity of support, due to so many factors, technology is booming elsewhere in other African countries, but technology is not only here. Sometimes people can say they just try to change the raw they are. But it is the raw and the issue, knowing your limitations, that bringing more partners to help you. Well, we are talking about even antimicrobial susceptibility testing. It is also limited in Liberia. That is a serious form of laboratory technology that is needed. But because of the lack of funding or limited fundings, we don't have these things performed in every hospital. And it is the right of every Liberian to health care. It's the right of every Liberian. It is a right. You go to the hospital, you don't have to pay $75 for antimicrobial susceptibility testing. Well, you have to pay because maybe Catholic Hospital, Jamali, all these people, few hospitals, and then government, public facilities don't have the resources. Though the government is trying, but the government should go more than that because the health should be the priority of us. Our chairman just spoke about One Health. Now we're talking about animal health, plant health, human health. Look, if you mess the environment up, you are directly, I don't want to use the word indirectly, you are indirectly messing yourself up. If you mess up your animals by giving them or you give them wanting use of antibiotics, it comes back to you. Somebody say cast your breath upon the water, and it can come right back to you, right? So that is what is happening in Liberia. So from the African region, just look at the little burning. There were 2.5 million deaths reported with bacteria AMR. Just bacteria AMR from the African region. Then we have CDC here, CDC in the Sinkor as well. And that is even an understatement. Remember, if you come there, you say bacteria AMR, not due to viruses, not due to fungal infestations and others, but just bacteria AMR. It's 2.5 million deaths. Now, the largest threat of AMR is attributed to lower respiratory infections and fungal infections, where you have 40% of all death. You see, 40% of all death. Now, this is actually, in reality, this is higher than what we have projected. This is really higher, because this data was about 2020, 2021. It's an old thing. Africa CDC, I think, has the most recent is higher than this, far higher than this. Now, if you look at the bloodstream infections, 56,000 deaths. Bloodstream infections, septicemia, all kind of infections in the blood. 56,000 deaths in sub-Saharan Africa. Now, we are not saying the whole Africa, but Africa below the Sahara, and that includes Liberia. Remember, we said Liberia has an attributable death of about 5,000 If they didn't accept it is an understatement, it is underrepresented. It should be more than that. Now, when we said, AMR, we need to go to the drugstore. The key thing about AMR that someone said, you need a very strong arm of education and awareness. You go and see poster in the public and say, buy this medicine that it can cure 5 different drugs. And nobody talks, nobody addresses them. They are free. And if nobody is arresting them, nobody is even making the person of insecure for them. The population thinks that it is a good thing they are doing. And the drugs are sold in buckets. And we are talking about technology. But how can we talk about technology when these simple things are persisting in our society? Wanton and irresponsible purchasing of products. People go anywhere and anyhow. I have a friend in the US, and she told me, please buy me antibiotics and send it. Yeah, they buy the medicine from here and send it there. They put it in their luggage and carry it. I have another friend whose daughter is dying from cancer of the womb. But we send the prescription for her. So 4 months have passed. They are saying no. They want to see the patient before they look at this person and medication. You send another prescription, it's a big no. In Liberia, it's a back. You don't need to see the patient. So we have limited implementation of health policies. We have good policies that are formulated, but limited information, and we have lack of political will. You are young people, we are saying these things. You said, I think Martin came here and said, we are the tomorrow. But if you must be the tomorrow, remember all the things that are passing, you will stand right here tomorrow and do it. If we don't change it, it becomes the same old thing we repeated and repeated and repeated. Perhaps you have wanted me to come and give you a kind of excellent speech. Perhaps you have come to hear me talking about technology, sequencing. But these simple things, if they are not followed, we can bring in the best of laboratory technology and set them down. If the mindset and education and awareness of you young people are not put into place, it will be a waste of resources, it will be a waste of all these normal people's time. When you run out, when we do a little survey here, how many of you after your menstrual period will take antibiotics? We're not careful. Almost everyone take antibiotics. Young men, how many of you can take antibiotics after exercising all your time? You're not careful. You see that some of them say, I don't feel today, I'm diabetic, so I take antibiotics. And we are all physicians and health workers in our own lives. And you see the recognize that is here for intra-abdominal infections. So if this intra-abdominal, the typhoid fever, why do you take typhoid fever? I don't want typhoid fever. Does not go away. Why do you think there was a constant recurrence of malaria? Why do you think there was a constant recurrence of infection? And remember I told you before, a constant recurrence infection, if you're not careful, leads to here is, and it leads to cancer, depending on the site where it starts. So these things are things to play with. For sure. We need to do more. We need to do more. Tuberculosis is another thing. Look at tuberculosis. The Ministry of Health and Health workers, they are fighting. But even the prevalence of tuberculosis is still low in Liberia. And even the treatment, there is something, it has just come to a barrier. No progress. Because even the patients themselves are not adhering to advices. They don't listen to healthcare workers, they rather listen to maybe traditional healer or case healer. And even the drugs that are being purchased, some are just substandard, counterfeit, and hospital data. So many factors in Liberia are killing our people. So this prevalence that we have posed here is actually an understatement. When you see that even Africa seems silver and green like this is lower, far lower. And if it is far lower in sub-Saharan Africa, think about Africa, which is a part of sub-Saharan Africa. give background materials, see for yourself. Streptococcus pneumonia, bacterial pneumonia, Escherichia coli. As they are listed, 1, 2, 3, 4. They are collectively responsible for 100,000 deaths each respectively. Each of them responsible for 100,000 deaths per year. It really, sir, it is an understatement because the data that actual may be at all one. The CDC will come and tell you 100,000 now, it is 2 billion. When we look at E. coli and Streptococcus aureus, we did a study just 2 years ago, one of my students in pharmacy school, and identified those pathogens on the door handle at the Liberia hospital, just as medicine ward, the door knob. And the key pathogen that came out was Streptococcus aureus and E. coli. Now remember, it was an AMR study, but in that study, majority of the antimicrobial antimarkers that we use, those microbial agents that we use, they don't work. Those antibiotics they don't work against Streptococcus aureus. The one that was actually potent, the one people was clindamycin. And clindamycin is least prescribed in Liberia. But the simple processing, all the amoxicillin, the prostacyclin were all dead. After clindamycin came this other one, there was another drug like tetracycline was 66%, and it tried. But many times we don't prescribe it too, or we prescribe simple processing. And as a result, these pathogens have built resistance, like our owner said, they were camouflage. You can't stand them again. And as they are moving from one person to another, they are mutating. Mutation is important. As they mutate, as they change in form and manner, they become very, very aggressive. It calls for technology. Technology is important, especially genomics. Understand the genetics, the pharmacogenetics we change from the population. Because right now in developed country, people look at the gene of the population and they know which treatment to give. That is done in the lab. A very advanced form of technology. So you can see even what we call ceftriaxone, third generation superspore, are not even working. They are not even working anymore. When somebody says, I don't take tablet, just shoot me with one, get me up. We get you up is a waste of time. I have a friend who had urinary tract infection and he had prostate. So over the time, over the 2 weeks, it was very intense. You know those things, especially when you're married, you bring marital disharmony also for those of you who are married. Because one person will say, you shouldn't only do that and they know it's in. We started with antibiotics, it will not work. You don't believe that we use azithromycin and doxycycline and flagyl over a week before that was treated. And which was highly unnecessary. Very, very unnecessary. But then he was complaining. And he had to go to work. He said, take over. How do you feel such among people and you are in pain? Imagine the kind of drugs that we use just to treat it. Imagine the reaction, the drug reaction. Imagine how he felt. But it was not working. So we had to do something very unimaginable. Antimicrobial resistance is real. If you are sitting here and you want to get some sort of technology, you will get the technology. But it comes to you as an individual. The health workers alone, animal health, human health, environmental health, you are the experts. These people sitting here are not the experts because they are not at home with you. They are not at home with you. We be anywhere, so we be anywhere in this country. That's one good thing I like about Liberians. We be anywhere. Anywhere I say we can be anywhere. Open air defecation. No, we using gender-based violence, which is here especially. Okay, but we be anywhere. Now, do you know your status? Do you know that if you are also having this particular condition, so as as a result, we contaminate the environment, our dogs, our cat, our pig and sheep, go and eat. Maybe we are serious for the greater scientific aspect, we give them antibiotics, So it will be like, the informal part. We don't give them antibiotics, but we allow them to roam. And it's anywhere, it's anyhow. As a result, it comes right back to us. Think that AMR is something that we are imagining. The difficulty of AMR is that we can't see it. You can't see AMR, that's the critical part of it. You can't really see it. But it comes back to you. Because you can see it, it is very complex. So even explaining it again is very complex. And I told somebody the information we get there should be in the Liberian context. So in this case, all of these that you see over here, they are taking a lot of access to crucial, more effective antibiotics. Crucial, more effective antibiotics. Now, we never have more effective antibiotics, just giving rise to an increase in the burden of AMR. So, how do we fight this? How do we mitigate this? The use of technology is important. Then there is the use of technology amongst the laboratory technicians. The use of technology amongst policy makers. The use of technology among the law enforcement officer. The use of technology amongst every fragment of every sector of the Liberian society is very important. But again, are we ready? That is the issue here. Hospital health, you may be ready. But are we really ready as a nation? If everybody, technology starts from the lab, AMR, technology starts from the education, the awareness, the social media, technology starts from the law enforcement officer, technology starts from the dentist, the vets, technology starts from everybody, all Nigerians. But as a country, are we ready? The donors may pump their money, give their money. Sometimes the donors give money, they don't realize anything. And you don't let them hear this sometimes when you say it. Donors put in $1.5 million. Who is to go find out like this and just trying to walk $5 US. And then you say we have what? Everybody eats their own. It is because of this everybody eats their own that Liberia is suffering today. We must make a change. It is because of this everybody eats their own. Donors will come and bring laptops, advanced laptop technology, go on the field, and all the laptops will be stolen. I'm sorry, that's me. I'm sorry, sir, that's me. If you don't start putting that culture of honesty into you, like you will leave it there, the children will come there. It's not like you're the children for everybody, not for anybody. And we begin to steal. We need technology. Technology will advance will lessen the burden of antimicrobial. Look, the use of technology is important. It mitigates the spread of AMR by improving the detection. It improves detection. Of course, technology improves the detection, improves the surveillance or monitoring, improves the patient protection, and the treatment strategy. But hey, Liberia, our young people, you invited all these policy makers. Are you ready as an individual? It starts from your home. It starts from you. The change that we yearn for, the change that we call for, the change that we all want, the change in lessening the burden of AMR starts with you. Technology. People will bring technology. They will bring the laboratory materials, but it will just sit down in one hospital and store. I know you have been having plenty of things like this. You know the honorable you have been having things like this in this country. People will bring laboratory material and they will just sit in the store. That's it. That's it. They don't know how to use that. How can you bring these everyday things out? And look, our taxpayers should demand these things. You young people should demand these things. You pay tax. Maybe you know that you are taxpayers. You should demand these things. They will bring in 1.5 million gallons worth of material in the lab, nobody will operate it. They will bring this particular laptop that will just at this tablet reporting in real time. They will bring this software, AI software, to help you lower the spread of AMR. At the end of the day, the use of this AI software will be changed into different things. That was it, Liberia here. This is not the Liberia here. I have come to let you know technology mitigates these things. But if we don't have a change in mindset, we don't have a change in attitude, if we don't have a change in the way we operate, our Buddha operandi, we will be right here. And all these books I know, if I can make a change in my generation, it is useless. All these things that we're learning, if you don't be from here now and begin to change, make us ambassadors of change, it is useless. Technology, you expect to expand and see technology. Yes. Technology actually makes a change, but your mindset is important. So technology is important because it improves the detection, it improves the monitoring, it improves the prevention and the treatment strategy. That is technology. So in terms of surveillance, okay, there are so many software, there are so many material equipment that people use. Our partners, others are using. Other countries are actually going far ahead. Yes, other countries. You won't believe it. When you enter other countries, you see them in terms of surveillance and monitoring. Now we use genomic sequencing. Another technique, you see the whole the WGS, the whole genomic sequencing. It tracks the evolution, it tracks the spread. Genomic has to do with genetics, your gene. In your family line, what have been changed? Who can be treated with amoxicillin? Who can be treated with maybe augmentin? Who can be treated with doxycycline? Genomics is important. Okay, it identifies the resistant strains and it allows for early intervention. In an event of outbreak, genomics sequencing is really important. It deals with the gene. Here's one argument and fun. We were discussing about genome antibodies. And then somebody said, so we could do genomic sequencing, and then we got to check the gene, genetics, then we'll know how to do the treatment. It is very true. Once you do the genomic sequencing, you know how to intervene and treat properly. But then the security risk attached with this is Africa. If you know the strength and weakness of my body, who do you just manufacture and just give everybody 1 week time? So I feel that it will not happen here. We will not agree. This policy is wrong. They start laughing. One of the generals said, yes, it is true. We are not ready for that. Okay, that's one. It is important. Genomic sequencing, data analytics, and AI. Now you all know, people instead of our young people studying for the test, they just go to AI. AI, explain class-square analysis. AI, tell me, what is the difference between this and that, and how can I implement this procedure? AI, I want to write a project proposal on this thing. Can you write for AI will give you in less than a minute. AI has supplied. Can we use AI now to analyze the data set from hospitals? Can we use AI to analyze the data from labs? Can we now use the AI? We can use AI to manage, to mitigate the spread of cancer bacteria. AI will actually support real-time surveillance and response. Because of the nature of AI, if our policy makers would turn it into a benefit for all healthcare workers, that would be a plus. Because it will actually track and monitor antimicrobial resistance. Electronic health records, again, I don't know, sir. How many hospitals, do we have hospitals now that are using electronic health records here? Okay, Ministry of Health.
The reference lab in Liberia, we have started genomic sequencing now. And we are supplying the reagents, first-class computers, laptops are provided. Yes, exactly. And usually that's why we are able to find trial 2A and 2B in Liberia for MPOS. So that is going on. And pharmacovigilance also, we have identified a pharmacovigilance specialist who is going to go to Ghana for training. And then I will give you some brief summary of all those things. So we are moving. But for electronics, I think government cannot be, we have a limitation.
Sorry, we said it will be interactive with our people, right? Yeah. Because you need the information. You don't want to go and not start that information.
For the Consummate, we have AMRS. We start from the facility level, we pick up this HMIS and try to collect information using the HMIS tool, and then it is spread to the
when you say HMIS, please for the benefit.
It's health management information system.
So, when we get to the DHR means what? Digital?
District and
information. Okay.
So that is the national repository for our data for now. So we are building what we call a ERDSR that is going to be interoperable with other data platforms. So it's almost like 85% complete. So the 100% the HSP, the health security projects, is going to fund it to ensure that everything is done. In that way, they will link information from the lab. They will also link information from our surveillance system of the AMR and even surveillance system from animal environments, human health. Everything, there are buttons that when you just press, whatever information you need will come out. So we call that electronic integrated disease surveillance and response platform. Thank you.
Hello, everybody. Hello. Isn't that wonderful? Isn't that wonderful? The reason I'm asking them to make comments, we always want to balance information. Whatsoever we say, then you see genomic sequencing is done in Liberia. That's how we have identified 1 and 2 of the MPOS. So meaning that you know yourself, MPOS is real. The non-military health looking for money. MPOS is real. You saw a comedian crying on social media. I think it's painful. And he cried. He said, I will not die, but I ask you people to be careful, prevent it. So now that we have genomic sequencing and we have other, welcome Chief.
Thank you.
We have other things related to the EHR. Liberia is gradually getting there. But look, technology is important, but your mindset is also very important in working. Let's look at the rapid diagnostic tools. Anything Liberia for AMR? Rapid diagnostic tools? Yeah.
Rapid diagnostic for malaria,
Yes, for
RSVT for malaria. We also have rapid diagnostic for even the diabetes. So you can use a rapid diagnostic to check the sugar level. HIV, HIV you also have a rapid diagnostic.
Thank you. So now, for rapid diagnostic tools, they are very important in this country. Well, one of our key points in the is sitting here asking like, hey, you know, rapid diagnostic tools are very important. Most times when you go to the clinic, when you prick your finger and you notice small shapes like poison, right? You are rapidly diagnosed. It reduces unnecessary antibiotics use. So it distinguishes between the kind of infection that you have. So nobody is going to treat like, you can see malaria reactive or typhoid reactive, and then you start looking for a different form of treatment for the person. So it actually distinguishes. And that is a form of common technology. It is common technology. The head of Public Health Institute, Dr. Chris, he has invented some kind of rapid diagnostic tools that will discover diagnose malaria, typhoid, or tumor. Yes, and he won international awards for that. But I don't know if those tools are in Nigeria, here. No, it is in Nigeria.
Yeah. Nantes, they call that Nantes.
Nantes, you have Nantes. It diagnoses Ebola, COVID. Imagine. So the other day, I'm meeting our chief. You got all respect. You yourself, you having also been in a situation here. Really, it's down. Nigerians are using it, Ghanaians are using it. So what that costs? And we're talking about what? Mitigating what? The burning of AMR in Liberia. Liberia has brains.
We working with him on that, the rapid diagnosis test, and even the manufacturing of reagents. We started the engagement as Africa CDC with Dr. Young, so that we see how best we can strengthen the Nigeria can even produce their own reagents. So this discussion is going on, but it's at an infancy stage now. So we will not disclose. Let's leave it here.
It's okay. It's okay. It's okay.
You understand?
It's okay. Now, are you following where we are going?
Yes.
Please, I hope we are not boring you. Because you are here to listen on this, right? So, Dr. Nan has a NANS test that can diagnose Ebola, COVID, malaria. Now that you see, African CDC control to tell you we are in the infancy stage, we are discussing so that Liberia will be greatly involved. It was significant participation, not something like Liberia. So meaning that behind the doors, behind the scene, they are working. Again, hats off to CDC Africa. Thank you for working. Yes. I think that was so, as we move forward, antimicrobial stewardship program. Now, again, although I'm a keynote speaker and I don't know what to say, but I have the policy makers who are strictly involved. Anything, any progress or anything in Liberia, antimicrobial stewardship. What is being done? How is it being done? Is Liberia making any strides at all?
So for the antimicrobial stewardship, there are two components: the laboratory surveillance and the antimicrobial stewardship. So for the laboratory component, we have selected sites, referred to as the sentinel sites, consulting ASD and reporting results. So for these sites, we have 3 sites actively consulting ASD, particularly we are reporting data to the machine. We have 4 ports due to the power outage issues and a lot of facility that have been able to report for a period of 2 years.
Okay, let me move there. For the sake of somebody who is asking, can you just tell us in one simple term, in the Liberian term, the layman term, is EST? NIA?
Yes.
Because somebody is saying, they're calling it antimicrobial stewardship. Because it has to do with the right use of these antibiotics.
The AST is the antibiotic susceptibility testing. So it's a test that is conducted.
Sorry, antimicrobial stewardship program, sorry.
The stewardship is the surveillance of checking on the antibiotics use in the facility, antimicrobial use. Then, when it comes to the surveillance portion, is about detecting to know the cases of resistance. How many cases of resistance we have in the facility? So, it's about detecting, knowing the burden of AMR in Liberia. So it detects the emergence of resistance. It also shows which pathogen, which antimicrobial disease causing agent. The pathogen is an agent that causes disease. So which disease causing agent
is building resistance to antibiotic. So we identify all of that in the stewardship program. And it's important for our country that we are able to report your data from national to make decisions.
Okay. Thank you.
So we also ahead.
Yeah.
As far as West Africa is concerned, the sub-region, Liberia is part and parcel of such a program. We coming to have a meeting in Abuja from the 23rd to the 27th of June. And then 2 persons are going to be invited. In fact, I'm processing their program registration since on Friday to today. We have one who is going to be the National AMR Surveillance Lead, and then one who is also the stewardship lead. So these 2 people are representing Liberia from the 23rd and the 27th in Nigeria. So the aim is to look at best practices in all the 15 member countries. What are the lessons we can learn? What is their level of this AMRC and stewardship at the national level, so that we can have a regional one, and then we guide the practices in member countries. So this is going on as we are speaking right now, and that's information is here.
Of the stewardship program.
Just tell us we are almost wrapping up, okay?
The antimicrobial use is where we have the problem. So we are still advocating for support to start the antimicrobial stewardship. It was initiated in some facilities. But when we did assessment, we observed that they were not really generating data, they were not having the regular meetings to do so. We needed support in the law, pride, support.
I'll use it
For sustainability.
God will bless you with money.
Yeah.
So you see that you don't want to let a cat out of the bag. I hope that I'm not boring you. But it's good to hear from them, right? You are at a conference, and at the conference you hear many things. Before somebody asks you, you say, oh, yes, whatever we enjoy. But you should be able to tell them, no, this is the strive we are making. We have gone far. So Africa CDC, thank you. But in seeing as much as you are doing it, please remember the CSOs and the young people. Then you will have a representative from there to train them also. Yeah.
We can put them as our partners.
Okay.
They are also joining the regional team from member states, but they will be part of the meeting to be held in Liberia.
Thank you, CDC Africa, and to other youth groups. You must be proactive because the future is yours. When I was coming up, somebody asked, they said, future leader. I said, when will I become future leader? They don't know that in your little corner where you are serving as the leader. And as they are leading the same, will depend on you to take over. And that is an improvement. Thank you, sir. So, answer my prayer, stewardship, these are all tools to monitor compliance. I think you still well. The next time we have everybody. So, answer my prayer is important. The stewardship is important because it helps them supporting clinical decisions. Decisions that are being the right job, the right individual, the right amount, the right timing, the right ways of monitor something like substance in the stewardship program. It calls for automated advice. And whenever you are doing the wrong prescribing, automated technological alert, red flag, this is wrong, do it this way. Other countries are doing it. Technology is improving. AI is improving. Now, smart prescription tools, mobile apps. People, sometimes when we say, we just think that mobile apps talk about by themselves, but people develop mobile apps, right? People develop the mobile apps, and people use those apps to prescribe. That is technology mitigating AMR. So it supports the healthcare providers. It reduces the over-prescribing and misuse of antibiotics. Now, when you Liberians are not for going to the hospital, when you give them only paracetamol aside, you say you don't have anything that's happening. Just take this painkiller and then rest your body. Then you say the health worker doesn't know anything. I hope you're not in that category. Don't say the health worker doesn't know. So with these mobile apps that will help you to prescribe to avoid the misuse of antibiotics. Environmental and agricultural monitoring. Now, Chief, I show you want to make small comment. Tell us about the environmental and agricultural monitoring, the technology that is taking place.
So you see what happening? We have an expert Human health is here. Now we have agriculture and environmental.
Well, for those of you who do not know me, I'm Sinkor. I work for National Fisheries and Aquaculture Authority.
Welcome.
I must say thank you for organizing this occasion. I'm happy, striving on the ring to be here. So thank you very much. Relative to the agriculture or environmental monitoring, specifically let me throw light on the fishery sector. So here we are working. As of now, for the time we are engaged with the AMR process, I told the last time, NAFTA or the fishery sector is not really a word of AMR program or AMR activities when it comes to the fishery process or the fisheries program in Liberia. So we are trying to incorporate how we monitor the AMR subjects in the fishery sector. So now to announce to you, I think some of our argument is yielding fruits, and then the acting director of NAFA has agreed that we do baseline survey when it comes to antimicrobial use in the aquaculture sector and that of our fish landing sites along the coast around here. So what we intend to do is we must monitor, even though we have regulations that say do not use antibiotics in the fish pond or to promote growth in watering, but still people use those things to treat diseases and other conditions in their farm. So now we cannot sit back and say everything is okay out there. And we cannot also say, indeed, we have this thing at this level. So what we intend to do is to do a baseline survey to monitor or assess the use of antimicrobial in the aquaculture sector and at our land sites. As such, we want to understand what's happening in the environment, what's happening in the fishery sector when it comes to antimicrobial resistance. For now, we have formed collaboration with the Standard Authority, LISA, the Liberia Standard Authority that is responsible for checking food stuff and other things, safety and whatever. And they should be coming to the fishery lab, which has been done for some time now. LISA will soon be moving there for us to start engagement with especially
I'm just watching on stage.
Yeah.
In terms of technology, what have you guys done? What is going on?
In terms of technology,
In terms of technological mitigation of AMR, anything?
yeah. This is what we have in place. We have it like this. We have a mobile data collection app.
Okay.
Yeah. That we assign inspectors. Yeah. We assign inspectors, enumerators, and aquaculture technicians at the virulent sites. And then this app, when we are proposing to management, we can use that app to monitor or collect data on our antimicrobial use in the sector.
Okay, thank you.
Yeah.
Thank you very much. I think you can see that again. You can see that our panelists up here as we ask them more of national concern, whether Liberia is gaining gradually. Because we need help for the environmental and agricultural monitoring. And he said mobile data collection are okay, meaning at least at the
Yes, they have tablets.
it is very important. Technology will post these things in real time. Public awareness. Now, as we are about to wind down, public awareness is another key thing. All this the talking has started from the beginning till now. I said if we have whole public awareness, whole level of education, it's a waste of time. It's a waste of time and our resources. It's a waste of my resources and time, a waste of the donors and partners' resources and time. It is a waste of their own resources and time if there is full awareness. Now, in terms of awareness and education, the social media plays a very important role. Because it is through technology that you easily copy through WhatsApp. It is through technology that WHO now has this WhatsApp chat room that has millions of people. And WHO will just come out in 1 second information is spread to everybody. COVID is this. Impulse is here. Do not go this way. Technology, everybody is happening now. It is happening now. Social media, Facebook, WhatsApp, TikTok, IG, Instagram. The information is carried, awareness is being made. Technology. Everybody has a phone. Almost everybody, if not everybody, has social media, the apps. Everybody we have e-learning platform. And this electronic learning platform will disseminate information to you. Wash your hand, do not shake hands because you have imports. Keep your distance from somebody. Do not have protected sex. Do this and do that. The do's and the don'ts. So these e-platforms are very important and they promote the responsible use of antibiotics. The responsible use of antibiotics. While we are calling for technology, the young people, still use the technology for the betterment of mankind. Use your brain, your mind, your thinking, your innovation for the betterment of mankind. Be the best you can be. Do not go and stop somewhere. What you have learned, improve it for your neighbor to learn. I always like to learn people. You can be a rich man, then here you are not venturing out of the school, or you're a rich man. So you can be educated, and then you are not using that knowledge for the betterment of your community. We have AI, drug discovery, and machine learning. These are all advanced technology. Liberia is 180 years old. We can move further. We can do more. But there are challenges in a way. And these are challenges. Some of the challenges, not more. So many LMRCs face big obstacles when implementing AMR service. Of course, there are obstacles to all this technology we are talking about. There are so many things. Funding is an issue. Consummate Health wants to do this, they may not have funding. Consummate Health wants to put their head here, they may not have the training power. They need sponsorship. So many things. Consummate Health or the youth organization, they want to go into bioinformatics, biotechnology to help them improve, design drugs, go into the system and bring out the genomic techniques that will help them. No money to go for it. It is too expensive to send people away. Now, as we know, the obstacles to surveillance or monitoring. One, limited implementation of national action plan, limited implementation. Who follow the good things in the national action plan for anti-microbial resistance? But then, no funding. Even the head, the other person here, he himself lying and cry, yes, I have crying. And sometimes when you are not there, you can feel that you're not working. But to release and die is very difficult. You will defend, you will justify, you will quantify, you will qualify, you will do qualify. At the end of the day, sometimes no one. Shall we for next year? You all have to put on next year. So limited implementation will be one. Limited infrastructure and institutional capacity that is happening. Consummate Health should be having office now. Their own building. But you will get it. Reduced investment and human resources. reduced investment in human resources. Now we're talking about technology, but even so, there is low investment in low human resources. But thank God for our partners who are seeing the need to invest in the young people. Because some will not even want to invest. See our partners sitting here. Some will not even want to sit here for 1 hour. Why not from the young people? But they are today's young people, tomorrow's elders. That's how life is. So you have to come in and get them the idea, because I believe some of us standing here, tomorrow some of you will stand somewhere saying,
open this big platform, and that is just online. Anybody can just become a part of. And then we do electronic learning, teach them more and more. AMR software relies on data from local hospitals. Now, again, technology. Do we have the technology to report in real time? It is happening gradually, like the company rep said. It is happening gradually. But again, technology advancement, technological improvement in this country will actually help us to advance the fight of AMR. Now, there are major gaps, like we said, in Liberia, including measuring the burden. Measuring the burden, the actual burden of AMR in Liberia is unknown. It is unknown. All because of what? Lack of adequate data, lack of pure data collection. And all these things will come to pass if we have technological involvement, if we have people who have the mindset to even go out there and educate and make public awareness. Like I said previously, the burden of AMR is not known, but even so AMR is invisible. So when you measure AMR to even educate people, they say, what do you call it AMR? We can't see it. So you even when they are talking about AMR to the farmer, the Zobo, the other people, like I said previously, you must contextualize your message. The message must be fit for the audience. Because if not, you'll be wasting your time here. You must contextualize the message. So, in closing, inadequate AMR preparedness. Evidence by the lack of implementation of national action plans. Evidence by the lack of implementation and utilization of technology. Because technology now is not really used in Liberia. We hope that after this conference, we can get to policymakers,